ICU liberation is actually a relatively new term, and it was coined by Sutter Health and is now used worldwide to describe changing the way we care for our critical care patients.
By utilizing the ICU Liberation Program, we implemented standard work with the support of an interprofessional team of nurses, physical therapists, physicians, pharmacists, and respiratory therapists. We rolled this work out across Sutter Health, and this standard work set the foundation for change in the way we're providing care.
The bundle has 7 components: assessing for pain and making sure that the patient's pain is controlled so they can rest and sleep well. If a patient's mechanically ventilated and receiving any sedation at all, we turn that sedation completely off at least once a day. We also do what's called a spontaneous breathing trial. For patients who are mechanically ventilated, we turn off all of the ventilator settings and allow the patient to breathe on their own. We also choose medications that do not cause delirium, and we reduce our overall levels of sedation to keep patients more awake. We assess for the presence of delirium. To see if it is there, we get patients up and moving out of bed sooner than we would have in the past. The last element, F, is including the family, not just engaging them, but empowering them to help us create the plan of care for their loved one.
Having the family involved in patient care is vital for them to understand the goals of care on a daily basis and to encourage the family to participate, whether it's physical therapy, if they're CAM positive, to encourage the family members to remind the patients where they're at, time of day, make it nice and bright. There's non-pharmacological approaches that the family can be involved in.
Not only do we encourage them to round with us daily, but we're also allowing this team approach where families feel more comfortable not only asking the physicians and the nurses questions, but myself as well.
Gives them comfort to know that, that their family member or their loved one is being taken care of and every aspect of their health is being addressed.
For each increase in 10% of bundle compliance, there was a 15% increase in hospital survival and the reduction of delirium and coma in the ICU.